Cleveland Clinic Rehabilitation Center at Euclid Hospital welcomes you to the place where thousands of people come each year to heal. From our own community and from across the country, patients choose our campus as their best chance to rehabilitate and recover, and not just physically. We work together to treat the body, mind, and spirit of every patient to help them return to life and to living. There are many reasons why people overcoming illness, injury, surgery, and disability come here. One is our highly experienced and compassionate staff. Another is our true team approach to rehabilitation. From Cleveland Clinic physicians, physiatrists, and nurses to therapists, social workers, a psychologist, and even family members, we put together teams according to the needs of each individual patient. To strengthen the chance for recovery, patients are followed by an interdisciplinary team from evaluation to the day they reach their rehabilitation goals. A physiatrist who works uniquely with the patient's needs and rehabilitation goals oversees each patient's treatment program. Rehabilitation nurses who are familiar with each individual patient provide meticulous care. They monitor medications, assist with managing pain, and help with bedside therapy. Social workers and nurse case managers help with planning, organizing, and coordinating services and resources to assist patients with the next steps following the rehabilitation program. Within Euclid Hospital's fully accredited Rehabilitation Center, patients receive physical, occupational, speech, and recreational therapy. Physical therapists are specially trained to reduce pain, improve range of motion, increase strength, and facilitate neurological rehabilitation. Prescribed exercises help patients regain independence. With occupational therapy, patients learn home management tasks and self-care, like feeding, bathing, and dressing. Patients also work on exercises that help increase the strength and motion needed to complete daily activities. Speech therapists help patients recover communication abilities, whether it's learning to speak again or learning alternate forms of communication. Patients who have suffered a stroke may require a speech therapist. Helping patients with swallowing and cognitive impairment is another important service provided by speech therapy. Recreational therapy helps patients get back to doing the things they enjoy. Patients at Cleveland Clinic Rehabilitation Center at Euclid Hospital may participate in a variety of alternative therapies like art, music, Tai Chi, and horticulture. These interventions help patients cope with lifestyle changes while learning the skills needed to return to leisure activities. Patients recovering from stroke, cardiac, or orthopedic conditions may benefit from specialized programs offered at Cleveland Clinic Rehabilitation Center at Euclid Hospital. Stroke rehabilitation is most successful when it's a team effort. Our treatment plans for stroke rehab are designed to meet each individual's specific needs. Examples of treatment include self-care skills, mobility skills, communication, and cognitive skills. Because stroke affects each individual uniquely, the rehabilitation team uniquely designs the plan of care. We have a cardiac rehabilitation program for patients who are in the hospital being treated for cardiac disease and who require inpatient medical rehabilitation to restore their former level of physical endurance and self-sufficiency. The orthopedic rehabilitation program serves patients with total joint replacement, injury from trauma, bone diseases, and amputations. Because these injuries and illnesses often limit self-care and home skills in addition to mobility, our team approach helps to speed recovery and the return to independent living. What better place to overcome the effects of illness, injury, surgery, and disability than overlooking beautiful Lake Erie? Nestled on the shore of this great lake, many of the patient rooms at Cleveland Clinic Center for Rehabilitation at Euclid Hospital afford beautiful views where patients enjoy serenity and peace of mind. We keep our patients active. They spend a lot of time out of their rooms interacting with other patients and learning how to return to everyday living. Our spacious modern therapy suites bring patients one step closer to home, Complete with a kitchen, living area, and bedroom, they work on getting back to the activities of everyday living, such as climbing stairs, cooking, making a bed, and getting dressed. We encourage patients to wear clothes they normally would wear to feel as comfortable as possible. From peaceful settings and modern therapies to therapeutic equipment and a healing garden, Euclid Hospital provides an oasis of calm where patients can heal physically and spiritually. Welcome to the Neuro Day Hospital program at Euclid Hospital, where we are committed to patients with a variety of neurological conditions such as stroke and multiple sclerosis. The only one of its kind in Northeast Ohio, this outpatient program is designed for patients who no longer require 24-hour inpatient care, but still require intensive rehabilitative therapy. Patients participate 2 to 3 full days per week for individual and group therapy and are regularly reviewed by a multidisciplinary team, including a physiatrist. Treatments include mobility and gait training, activities of daily living, speech therapy, medication management, and memory and problem-solving techniques. The Parkinson's Disease Comprehensive Care Program at Euclid Hospital offers specialized care for all Parkinson's disease patients, from initial diagnosis to advanced stages. The goal is to help patients improve their quality of life. The initial consultation includes evaluations by a neurologist. Following the assessment, they create a plan that may include coping strategies, lifestyle changes, and caregiver education. This program is ideal for patients seeking a comprehensive evaluation, but who may not be able to travel to Euclid for ongoing therapy. Recommendations for further treatment are forwarded to the patient's treating physician. Unique to Northeast Ohio, this program is offered in partnership with Cleveland Clinic Center for Neurological Restoration. For patients who do not require inpatient care, Euclid Hospital maintains a comprehensive outpatient rehabilitation center. Our outpatient programs typically last 2 to 6 weeks and are committed to helping patients regain their independence. Driving a car is an important part of independence. Through our Driving Assessment and Rehabilitation Program, an outpatient program, patients have access to the latest technology in simulation-aided driver assessment and training. Behind the steering wheel within the safety of a simulator, patients develop the ability to recognize, analyze, and correctly respond to traffic situations. As a result, we are able to encourage those who are able to learn to drive again, identify those who may need additional assistance before they can drive, and finally, identify those who can no longer drive a vehicle. Euclid Hospital also offers more than a dozen other outpatient programs that use the mind-body connection to nurture the creative and expressive side of each patient. From Tai Chi, aquatic, and horticulture therapy to pet and cooking therapy, we are committed to using every therapeutic method available to rehabilitate our patients. The Cleveland Clinic Rehabilitation Center at Euclid Hospital is fully accredited by the Commission on Accreditation of Rehabilitation Facilities and the Joint Commission. For more than 30 years, thousands of patients a year have trusted us to help them to return to life and to living. Through intense and innovative therapy programs, a team-based approach, and unique amenities and services, Cleveland Clinic Rehabilitation Center at Euclid Hospital is here to heal. Now that you've toured our facility in a virtual way, please come visit us in person to experience all that we have to offer. You'll discover a home away from home with highly trained, experienced Cleveland Clinic professionals. Thank you for taking the time to watch this video.